Hello, welcome back to another video from me. In today's video, I have like a full-length mock exam test for you all. This is part 2. I have part 1 already made, as well as other review lessons in my playlist. So if you click on the videos that I will attach to the end, you can get to part 1 of the mock exam, and then you can get to my other videos that I have. All right, so if you're new to my videos, I always like to show what will be covered on the ARRT exam. However, if you are watching this video from another country or somewhere else, you can still use this information to help you study for your registry. The information is the same, but the way they may ask you different questions, like if it's matching, true, false, fill in the blank, that may be different, but just the information that's pretty much the same. So, patient care, 22 questions, safety, 22 questions, image production, 50 questions, procedures, which is your anatomy, 71 questions, which is the largest portion of the test. Also, physics is 2, which will give you like a total of 165 scored questions. But if you look at the bottom, there is 30 unscored poly questions that they will throw in there, but you may not, like, you won't be scored on it, but it'll just be thrown in like the mix of the other questions. So let me know in the comment box if you have any questions about this information. I do have other videos in my playlist where I discuss this. All right, so I did a poll probably 2 weeks ago or a month ago from now, probably 2 weeks ago, and I asked everyone pretty much how many questions would you like for me to put in a video, because I really don't get a lot of comments on my videos, so I really don't know what you all want. So lately I have been making, I think, 20 or 30 questions, and then people was asking for more questions because I would ask the question in my video. So a lot of people voted for 50 questions, but no one commented under the post to let me know which modality this is for, because I make videos for X-ray and CT, MRI, and mammography. So if this is like a video that is too long for you, all you have to do is pause the video if you have somewhere to go, something to do, write down the question that you stopped on, and then come back and just play it again, or put it at the part that you was on. So this video will have 50 questions. Shout out to this person who did leave a comment under, it looks like my first CT Registry mock exam video, and which I posted a month ago because no one wasn't commenting and let me know they would like part 2. Um, so if you want part 3 or more videos like this, could you please give this video a thumbs up and comment down below? This person told me that they wanted part 2, so shout out to them. And then I asked them, I think I asked them how many questions did they want on the next video, and they said 50 would be great, because I was like, do you want 20 or 10, 20, 30 or whatever, 50? They was like 50 would be great. And then they also let me know that they were taking their test next month, which is helpful too, because if I know if you're taking your test 2 months from now, a month from now, it can help me hurry up and get out the video so that I could try to have one out before you take your test. So shout out to this person, and then thank you all for whoever participated and voted on the poll as well. All right, so the reason why I have this disclaimer up here is because sometimes I get questions under my videos and they ask me, is this the exact wording that will be on the registry exam? So this is the disclaimer that you all can either read out there on your own time, or just listen while I read it real quickly, just so you all can have an understanding of these questions and answers. So these practice test questions and answers are made to help you all pass your registry exam. Due to the registry board's copyright law, these questions will not appear on your registry examination in this exact wording, but they are designed and constructed to test your knowledge in order to help you pass your registry exam. Since it takes time, effort, and research for me to make these videos for you all, I am going to read each question answer choices, and the correct answer to avoid anyone from reusing my material and voice. If the audio bothers you, please mute the video. Being so, these questions are available to you for free. Could you please like, subscribe, and share the video? I would greatly appreciate it. Thank you all for watching and good luck on your registry examination. Please give the video a thumbs up or leave a comment if you would like part 3 to these videos. It will help you prepare to take your ARRT registry exam as well as pass it. And I do have 3 or 4 other questions and answer videos if you want to click on the playlist at the end, or always look in my description box. In my description box, I always leave like a lot of information for you all. Also, if you could please give the video a thumbs up for me and comment below and say something like thank you or great job. I spent most of my whole Saturday, which was yesterday, August 23rd, 2025. I spent probably most or pretty much all of my Saturday getting these questions together for you, because when I make these questions, I am, generating this based off of my own thoughts. So it does take a lot of time because I'm not copying these questions from a book. Since I am a teacher, I make up these questions on my own to help you all pass, because I passed mine on the first try. All of my registry exams that I've taken, which is 5, I've passed them all for X-ray, CT, MRI, mammography, breast ultrasound. So that's why I make these videos to help you all pass on the first try. So anyway, I just wanted to throw that disclaimer out there so people can know that these questions will help you, but it's not going to be in this exact wording on your test. All right, so like I was saying, I am going to read the questions, answer choices, and give you time to think of the answer. If this is your first time watching a video, please pause the video or rewind it if I'm going too fast. All right, so question 1. Which lab test is used to evaluate the kidney function before injecting iodinated IV contrast? A, estimated GFR. B, partial thermoplastin time. C, platelet count. D, prothrombin time. And I'll give you a few moments to think about the answer. All right, the correct answer is A, estimated GFR. So an estimated GFR, creatinine and bun test is used to check the kidney function before you inject iodinated IV contrast. If the number is below 40, your GFR number for that patient, check with the radiologist to see if you can still do it and maybe just reduce the dose, or if you can do it and give normal dose, or if you cannot do it and the order has to be changed to a without contrast. Question 2. The most radiosensitive organ that is found in the chest is A, aorta, B, breast tissue, C, esophagus, D, heart. All right, the correct answer is B, breast tissue. Question 3. Which factor controls image noise on the final CT image? A, changing the field of view. B, increasing the mass. C, keeping KVP the same. D, reducing the slice thickness. All right, the correct answer is B, increasing the mass. So whenever I normally have to increase the mass, It's pretty much because of like a CT PE exam, where due to the body habitus, the image was just a little grainy. So whenever you increase the mass, it will reduce the noise on the image, but it will also increase the patient radiation dose. So just look at that the next time you do like a PE scan or something. Um, if it is noisy, try increasing your mass just a little bit. You do not have to go from 40 to 100, like 40 mass to 100, but like say for instance, if you go from 40 mass to 45 or 40 mass to 50 mass, um, see the difference that it does make on the image. But sometimes whenever you change those settings, it will give you like an alert. And I always put mass increase due to body habitus or something like that. Also, let me know in the comment box which CT scanner do you work on. So when I do work in CT, because I'm a multimodality tech, but when I do work in CT, I work on GE scanners. I have worked on a Siemens scanner, and I first started training on GE, so I love GE. Um, but let me know in the comment box. Siemens is great too. All of them is great, but sometimes I feel like whatever scanner you started off training on, that's the scanner you pretty much like to continue working on. All right, question 4. Which anatomy structure is the arrow pointing to? Is it A, the aorta, B, LAD, C, LCX, D, RCA? And I'll give you a hint. This is for a calcium score. So that's the hint I'll give you. All right, the correct answer is B, LAD. So are you familiar with calcium scoring and how to perform them? Um, just let me know in the comment box. You also, whenever you do calcium scoring, the machine that I'm working on, you have to score it on your own. So that's a good way of knowing your anatomy. But some machines automatically scores it for you, but you still have to double check, because just like humans, computers can have technical mistakes too. But the arrow is pointing to the left anterior descending artery. That's what LAD stands for. Question 5. What is the Hounsfield unit of water? A, negative 1,000. B, 0. C, 500. D, 1,000. All right, the correct answer is B, 0. I do have a full video in my CT playlist. I will put the playlist at the end of the video as well as part 1 to the mock exam for you to click on the playlist, and you can see like a full video of the Hounsfield units and the numbers that goes to them and which organ is for. So you'll be able to see that in that video for my playlist. All right, so if you are finding this video helpful, please like, share, and subscribe for more videos. Like I was saying, I would greatly appreciate it, because I did spend a lot of my Saturday yesterday making this, putting this information together, and then I got up on my off day at 7 a.m. to try to record it, so that it can be out today, which is Sunday, August 24, 2025. So just please like, share, subscribe. I will appreciate it. Question 6. The common location for a partial volume artifact is A, the heart, B, the foot, C, the posterior fossa, D, the spine. All right, the correct answer is C, the posterior fossa. Question 7. Ring artifacts are caused by A, faulty detectors, B, metal, C, patient motion, or D, patient positioning. Right, the correct answer is A, faulty detectors. So normally whenever you do your QA, daily QA in the mornings, you are able to catch the ring artifacts. If you do notice one, you always should, of course, let your supervisor or manager know, and then they will or you will call a service engineer to come out because you cannot do CT scans on a machine that you know has artifacts because if a patient is scanned, then the ring artifact will get in their anatomy of interest, which the radiologist won't be able to make proper diagnosis whenever there is an artifact in the way. So that's why it's important to make sure that you are recognizing this on the image before you even scan your patients. I know some facilities have their night shift tech run QA or QC, but if you work at an outpatient imaging clinic, you will have to pretty much, run this when you get there first thing in the morning before you scan any patient. So put it down in the comment box for me if you work at a hospital, doing your CT training, or if you work at an outpatient imaging clinic. Question 8. Which anatomy structure is the arrow pointing to? A, ascending aorta, B, descending aorta, C, inferior vena cava, D, superior vena cava. All right, the correct answer is A, ascending aorta. Question 9. Which anatomy structure is the arrow pointing to? A, ascending aorta, B, descending aorta, C, inferior vena cava, D, superior vena cava. All right, the correct answer is B, descending aorta. So you will have to know, especially your anatomy for your, brain or head, chest, abdomen, all of your anatomy. Um, Make sure or let me know in the comment box which type of videos or question would you like me to add if I do more, depending on, how many people want me to make more of these videos. Would you like more patient care questions, patient safety, physics, anatomy? Just let me know. I'll also mention this again later on in the video in case someone missed this question. Question 10. Which position are patients mainly placed in for a CT scan? A, decubitus, B, lateral, C, supine, D, prone. All right, the correct answer is C, supine. Question 11. Which medication is given to patients to pre-medicate them before an iodinated contrast CT exam if they have a mild reaction to iodine? A, prednisone, B, Tylenol, C, Xanax, or D, Zofran. All right, the correct answer is A, prednisone. Doctors may order prednisone and or an antihistamine before having a CT contrast study done on a patient. This depends on how important the doctor need the exam with contrast. Majority of the time, the order may be changed to a without exam if necessary, but if this like a stroke patient or they're trying to rule out a stroke, if the patient has like trauma, then it may call for a patient to have iodine if it's like a life-saving, exam. But if the doctors and the radiologist feel like the exam can be done without iodine and you can still get great results, then the order will probably most likely be changed. Question 12. Which isolation precaution is used for a patient with tuberculosis? A, airborne, B, contact, C, droplet, D, standard. All right, the correct answer is A, airborne. Airborne precaution is used for tuberculosis, measles, and chickenpox. So for airborne precautions, you want to make sure that you have on your PPE, your N95 mask, your gown, your gloves. So just make sure you know that. And this is also good for whenever you are working as a tech. Question 13. Which isolation precaution is used for a patient with a cough? A, airborne, B, contact, C, droplet, D, standard. All right, the correct answer is C, droplet. Droplet precautions is for a person with a cough, sneeze, flu, etc. Wear your mask, your surgical mask, gown, gloves, your all your PPE. Question 14. Which isolation precaution is used for a patient with C. diff? A, airborne, B, contact, C, droplet, D, standard. All right, the correct answer is B, contact. This is used for someone who has C. diff or MRSA. For your PPE, make sure that you have your gown and your gloves on. Question 15. How long should a patient be NPO for a CT scan of the abdomen? A, 30 minutes, B, 1 hour, C, 2 hours, D, 4 hours. All right, the correct answer is D, 4 hours. A patient should be NPO for at least 4 hours before a CT abdomen scan. Um, please don't get in a rush and like, oh, we have 15 patients order. Let's go ahead and get this patient down since they're wheelchair patient. Let's get it knocked out. Wait the 4 hours that you're supposed to wait, which is at least 4 hours, because this can like cause artifacts in the abdomen area. Maybe you can't see well what is in the stomach. So you have to go by this rule of thumb that was placed. So this helps the patient be able to get proper diagnosis. So just keep that in mind whenever you are trying to rush your patients in and out. All right, so if you could please leave a comment. Let me know how you all are doing on the questions. Also, let me know if you are liking these practice test questions and answers for your review. Don't forget to check out my CT Registry Review playlist. I will have a link to the end of this video for you to click on. Question 16. Which procedure involves an iodinated contrast agent being administered under gravity and into the bladder by a Foley catheter? A. CT enterography. B. CT enteroclysis. C. CT virtual colonoscopy. D. Cystograph or cystography. All right. Those were some tongue twisting words. The correct answer is D. Cystography. Have you all performed a cystogram before? I know at the hospital that I work at, they come every so often. Like we may see one month and then may not see another one for 6 months to a year. So let me know if this is something that you have seen or have done a lot at your site. Question 17. If extravasation occurs during a CT PE exam with contrast, what should the technologist do first? A. Continue the scan. B. Inject more contrast. C. Nothing. Extravasation is normal. D. Stop the scan. All right, the correct answer is B. Stop the scan. If you all do not know, extravasation is when the contrast is leaking into the surrounding tissue and not entering into the actual vein through the IV site that you or someone else have started. If it does occur, stop the scan immediately. Most tech will either apply a warm compress or a cold compress to the site with a towel. The choice depends on how high or low the viscosity and the osmolarity of the contrast is. Question 18. Which anatomy structure is the arrow pointing to? A, L3, B, L4, C, L5, D, S1. Right, the correct answer is D, S1. Question 19. Which anatomy structure is the arrow pointing to? A, basilar artery, B, carotid bifurcation, C, external carotid artery, D, subclavian artery. All right. The correct answer is A, basilar artery. Question 20. Which anatomy structure is the arrow pointing to? A, basilar artery, B, carotid bifurcation, C, external carotid artery, D, vertebral artery. All right, the correct answer is D, vertebral artery. Question 21. Which anatomy structure is the arrow pointing to? A, basilar artery, B, common carotid artery, C, external carotid artery, D, subclavian artery. All right, the correct answer is B, common carotid artery. So please do not skip these questions that I'm going with you over your CTA neck. Please look at them, review them, study them over and over and over. Question 22. Which anatomy structure is the arrow pointing to? A, basilar artery, B, common carotid artery, C, external carotid artery, D. Subclavian artery. All right, the correct answer is D. Subclavian artery. So to be more specific, the arrow is pointing to the left subclavian artery. Question 23. Which anatomy structure is the arrow pointing to? A. Basilar artery. B. External carotid artery. C. Internal carotid artery. D. Subclavian artery. All right, the correct answer is C. Internal carotid artery. You can go back and rewind and rewatch this, the arteries. Make sure you know your arteries. Question 24. Which anatomy structure is the arrow pointing to? A. Basilar artery. B. External carotid artery. C. Internal carotid artery. D. Subclavian artery. All right, the correct answer is B. External carotid artery. Question 25. What is the Hounsfield unit for dense bone? A. -1,000. B. 0. C. 500. Or D. 3,000. All right, the correct answer is D. 3,000. Question 26. The connection between collimation and table movement per gantry rotation is defined as A. Effective mass. B. KVP. C. Gantry. D. Pitch. All right, the correct answer is D. Pitch. Question 27. A pan scan for trauma patients in the emergency room CT scanner would consist of A. Chest and abdomen scan. B. Head only scan. C. Head and C-spine scan. Or D. Head, C-spine, chest, and abdomen / pelvis scan. All right, the correct answer is D. Head, C-spine, chest, and abdomen / pelvis scan. So comment down below and let me know if you knew what a pan scan was. Do you work in a hospital or outpatient imaging clinic? These are typically performed in the ER setting with trauma patients. Question 28. A patient may have to lay prone for a CT scan involving the A. Abdomen. B. Chest. C. Knee. D. Spine. Right, the correct answer is B. Chest. A patient will have to lay prone on their stomach. That's what prone means for a CT chest scan specifically made for high resolution computed tomography. So that's your HRCT scan, high resolution scan, or you may hear it be called high res. Question 29. A cardiac CT calcium scoring exam consists of A non-contrast scan. B, a contrast scan with iodine. C, the patient drinking Valium. D, the patient laying prone on their stomach. All right, the correct answer is A, non-contrast scan. Contrast is not used or required for a CT calcium scoring exam. So that's always going to be done without contrast. Question 30. A high-resolution CT chest of the lungs is used to rule out all of the following except A, asthma, B, cancer, C, cystic fibrosis, or D, emphysema. All right, the correct answer is B, cancer. A high-resolution CT chest is used for lung disease such as emphysema, bronchiectasis, sarcoidosis, cystic fibrosis, COPD, asbestosis, and asthma. So that's what that scan is typically used for. Question 31. A coronary calcium score of 11 indicates a mild amount of calcified plaque in the coronary arteries. B, a minimum amount of calcified plaque in the coronary arteries. C, a moderate amount of calcified plaque in the coronary arteries. Or D, a normal scan. All right, the correct answer is a mild amount of calcified plaque in the coronary arteries. Question 31. A coronary calcium score of 10 indicates A mild amount of calcified plaque in the coronary arteries. B, a minimum amount of calcified plaque in the coronary arteries. C, a moderate amount of calcified plaque in the coronary arteries. Or D, a normal scan. All right, the correct answer is B, a minimum amount of calcified plaque in the coronary arteries. Question 32. A coronary calcium score of 500 indicates a mild amount of calcified plaque in the coronary arteries. B, a minimum amount of calcified plaque in the coronary arteries. C, a moderate amount of calcified plaque in the coronary arteries. Or D, an extensive amount of calcified plaque in the coronary arteries. All right, the correct answer is D, an extensive amount of calcified plaque in the coronary arteries. All right, so let's review our calcium scoring for CT. For numbers 1 to 10, this is a minimum amount of calcified plaque in the coronary arteries. Score 11 to 100 is a mild amount of calcified plaque in the coronary arteries. For numbers 101 to 400, this is a moderate amount of calcified plaque in the coronary arteries. Anything greater than 400 will be considered an extensive amount of calcified plaque in the coronary arteries. Question 33. Which landmark does the common carotid artery bifurcates into the internal carotid artery and the external carotid artery? A, C1 to C2, B, C2 to C3, C, C3 to C4, D, C4 to C5. All right, the correct answer is C, C3 to C4. Question 34. The abdominal aorta bifurcates into the common iliac arteries at the level of A, L1, B, L2, C, L3, or D, L4. All right, the correct answer is D, L4. Question 35. If a CT perfusion scan is ordered, this is ordered to rule out A, altered mental status or AMS, B, brain stroke, C, cancer, D, dizziness. All right, the correct answer is B, brain stroke. Have you all done a CT perfusion before? Um, do you know how to do it? Have you seen one before? Whenever this is ordered, it is like an increased amount of radiation dose. So that's why it's important to tell the patient hold extremely still. Make sure that you have them positioned correctly so that you can get it done in one sweep the first time. This is normally done in the emergency room setting, like in the ARRT CT scanner. Normally, this is not done in outpatient imaging because when this is done, like a patient is coming in for an emergency, they could be having a stroke. Question 36. Which windows are used to identify fractures in CT? A, bone windows, B, lung windows, C, soft tissue windows, D, standard windows. All right, the correct answer is A, bone windows. Question 37. Which reconstruction is used to make a sagittal or coronal image? A, MPR, B, MIP, C, volume rendering, or D, shaded surface display. All right, the correct answer is A, MPR. Question 38. Which reconstruction is used for vessels? A, MPR, B, MIP, C, volume rendering, or D, shaded surface display. All right, the correct answer is B, MIP. Question 39. The ability of a system to freeze motion, which provides an image free of blurring, is called A, contrast resolution, B, pitch, C, spatial resolution, or D, temporal resolution. All right, the correct answer is D, temporal resolution. Question 40. The ability of a system to show fine details separately is called A, contrast resolution, B, pitch, C, spatial resolution, D, temporal resolution. All right, the correct answer is C, spatial resolution. And I do have a physics video part one of the Q&A. So if there are physics questions that you aren't seeing in this video, it's because I probably already have them in the other physics video that I made like this. Or if there are anatomy or patient care questions that you're not seeing, it's more than likely that I already put this in another practice test question and answer video, which you will find by clicking on playlist, CT Registry Review, or you can just click on it at the end of the video. Question 41. Which of the following have units that are given in the line pairs per centimeter or LP/centimeter? A, contrast resolution, B, pitch, C, spatial resolution, or D, temporal resolution? All right, the correct answer is C, spatial resolution. Question 42. The ability of a CT system to distinguish between objects with subtle differences in X-ray attenuation or density is called A, contrast resolution, B, pitch, C, spatial resolution, or D, temporal resolution? All right, the correct answer is A, contrast resolution. Question 42. Which of the following measures the dose for an entire series of CT images? A, CT dose index, B, CT number, C, dose length product, D, dose profile. All right, the correct answer is C, dose length product. Question 43. Which of the following measures the radiation dose that is received in a single CT section or slice? A, CT dose index, B, CT number, C, dose length product, or D, dose profile? All right, the correct answer is A, CT dose index. I'm noticing that some of the questions that I have is like double, so you may see 242s, 243s. It was late, so I was working on these questions for y'all. So if you see extra numbers, then you have extra questions. So question 43. This is a situational question. Which CT exam was performed based off of looking at details and the conditions from this image? So looking at this image, which CT exam do you think was performed? A, coronary CT angiogram, B, chest without, C, CT PE study, or D, non-contrast calcium scoring? All right, the correct answer is D, non-contrast calcium scoring. Question 44. Which scan is ordered when there is an elevated D dimer? A, chest without, B, CTA abdomen and pelvis, C, CTA head and neck, D, CTPE? All right, the correct answer is D, CTPE exam. Question 45. A GFR of 15 indicates that a patient may be A, dehydrated, B, in renal failure or close to it, C, hydrated, or D, nothing. This is a normal number for healthy kidneys. All right, y'all. If you all made it this far in the video, um, put down I made it to the end in the comment box, or put great job, put something like that so I can know that you made it to the end of the video. The correct answer is B, in renal failure or close to it. Question 46. Which of the following is the best way to reduce radiation dose in pediatric patients? A, decrease pitch, B, increase KVP, C, increase mass, or D, increase pitch? All right, the correct answer is D, increase pitch. Question 47. Which unit is measured in grays? A, absorbed dose, B, CT dose index, C, effective dose, or D, exposure? All right, the correct answer is A, absorbed dose. This is the measurement, or it measures X-ray energy per mass. Question 48. Which unit is measured in Rankins? A, absorbed dose, B, CT dose index, C, effective dose, D, exposure? Right, the correct answer is D, exposure. This is how X-rays are able to ionize in a volume of air. Question 49. Which of the following controls the quality of the X-ray beam? A, dose profile, B, KVP, C, mass, D, spatial resolution? All right, the correct answer is B, KVP. All right, last question. Which of the following is used to decide how much contrast a patient will receive for a CT abdomen scan? A, equipment type, B, gender, C, height, or D, weight? All right, the correct answer is weight. All right, so that's it. We made it, or you all made it to the end with me. Please leave a comment for me. Let me know, did you find these questions and answers helpful to you? What other questions or videos would you like to see from me? Also, comment down below your test date or how long you are going to prepare for your registry exam. Also, check out the playlist that I have, because I already have over 20 videos in there. So there may already be a video made But if it's not, you can leave a comment for me and I will try my best to get to them. But it's just good to know when you all are taking your test because it just helps me try to, speed it up and get the video out since I work as well. So these videos are time consuming to make, but I do enjoy making them because I want you all to pass. But just leave me a comment and let me know. Also, thank you all for watching. This is the second set of questions for the CT mock exam. I have part one. You can click on the video up here that I will link. Also, I have a previous video. If you could, please check it out in my CT registry review playlist or other videos as well in CT. I will upload more set of questions and answers if I get someone just telling me to. If I don't see any comments, then I'm just going to think that you all have the information that you need, or you all have watched my other videos and that's plenty information for you. So if you would like me to keep making more of these videos or more CT review lessons for you, just comment down below or also give the video a thumbs up. And yeah, just let me know what you all would like for me to do. Good luck on your CT registry. Come back to one of my CT registry review videos. Let me know how you did on your registry. Let me know if you passed. Let me know when you're taking your exam. Also, let me know what you thought about these questions that I have in this video. But other than that, thank you all for watching and good luck on your exam. Also, you can use this for your CQR. So whenever you pass your registry, come back to these videos and review them for your CQR assessment that you have to do every 10 years. All right, that's it. Thank you. Bye.